Hi, my name is Melissa, and today we're going to be administering injections for IM subq intradermal. So I'm going to verify I had the correct patient, and I'm going to verify the orders on my computer. So for IM, we're going to be doing the flu shot, where we're going to be giving Fluzone 1 ml. For intradermal, we're going to be doing the TB test, giving tuberculin 0.1 ml, and for subq, we're going to be giving insulin 10 units. So I'm gonna go ahead and gather all my equipment, my appropriate syringes, needles, my vial, my alcohol swab, and my gauze. I'm also gonna go ahead and take a look at my patient's history. Once I've done all that, before I went to the patient room, I'm gonna verify every medication on the monitor and verify the expiration date on every single one of them. Now that I've done that, I'm gonna take my equipment with me into the room.
Hello.
Hi, my name's Melissa. I'm going to be your nurse today. Can I get your full name and date of birth?
Cindy Gonzalez, 1191.
Okay. Do you have any allergy to any medications?
No.
Okay, so today we're going to be giving you 3 injections. IM, the subq, and intradermal. We're going to be giving you the TB shot, the flu shot, and we're also going to be giving you insulin. Have you ever had any of these done previously?
Yes.
Have you been positive for your TB previously?
No.
Okay. Any no reactions to any of them?
No.
Okay, so I'm gonna go ahead and wash my hands, put my gloves on. I'm also gonna verify my medication one more time on the monitor and in the expiration date. I'm gonna make sure I have the right patient, right drug, right dosage, right route, and right time. Once I have all that, I am going to start preparing my medication. So for IM, I'm going to go ahead and grab my 3 ml syringe and attach it to the needle. I'm going to go ahead and remove the cap of my vial and clean it for 10 seconds with an alcohol swab. I'm going to go ahead, once I've done that, I'm going to remove the cap to my needle. I'm gonna draw 1 ml of air back and insert it into the vial. Flip it over, push the air in, and remove 1 ml. So once I've done that, I'm gonna make sure I don't have any air bubbles, recap my needle. And I am going to switch needles. I'm going to go ahead and look at my site. I'm going to do the arm, the deltoid muscle. I'm going to go ahead and clean it with alcohol swab. I'm going to remove my needle cap. And I'm going to do the Z-track on the deltoid muscle, and I'm going to insert at 90-degree angle. I'm going to insert my medication, pull the needle out, remove my fingers from the skin, recap the needle, and dispose of it in a sharps container, and document that the injection was given. I'm also going to assess the site after it's given, and I am going to inform the patient they're going to stay 30 minutes until I reassess and look out for any reactions to the medication given. Now for my subq, we're going to do insulin 10 units. I'm going to make sure I have my insulin syringe. I'm going to go ahead and do the same thing with my vial, remove the cap, going to clean it for another 10 seconds. I'm going to, once I've done that, I'm going to remove the cap of my needle, draw back 10 units of air, insert it into the vial, push the air in, and draw back 10 units. Once I've done that, I'm going to make sure assess for air bubbles on my needle. I'm going to go ahead and do the lower abdomen for my site. I'm going to go ahead and clean my site, pinch, and go in at a 45-degree angle. Insert, draw the med, pull the needle out, and let go of the skin. Same thing, I'm gonna go ahead and reassess after the medication is given. I'm gonna recap my needle and dispose of it in the shock container. Same thing for Subq, assess after 30 minutes for any type of reaction. Now, I'm also gonna go ahead, before I go to my next one, to document the injection was given. Our last one would be intradermal, which is gonna be our TB test. I'm gonna go ahead and remove the cap of my vial, clean it with an alcohol swab for 10 seconds. Once I've done that, I'm gonna remove the cap to my needle. I am going to draw back 0.1 ml, insert it to the vial, flip it over, push the air in, and draw it back. I'm gonna make sure I have the exact amount, assess my syringe for any air bubbles. We're gonna go ahead and do the forearm for the TB. I'm gonna go ahead and clean my site. I'm gonna go ahead and go in at a 15 degree with my, I don't know what it's called right now, valve or bulbed up, or my bevel up at a 15 degrees. Once I insert the site, go ahead and insert my medications, maybe a small blood. Remove the needle and recap it and dispose of it in the sharps container. I'm gonna wipe down with the gauze and tell the patient not to touch and scratch, just to leave it alone, because it can give false positive results, and will be checked in 72 hours, 3 days for results. Once I'm done with that, I'm gonna go ahead and document. Same thing, assess patient 30 minutes afterwards for any type of reactions.
Good. Does she have points?